and a brilliant surgeon. She's innovated so many techniques, and she has done pioneering work with the Advanced Vision Analyzer, which recently also got recognition by a very good publication. So I think it'll be really nice to hear. I've had my hands on the Advanced Vision Analyzer as well and really enjoyed it. So Priya, please go ahead.
At the outset, I would like to thank AIOS and Ashwin and Dr. Kaurav for this wonderful opportunity. And I really feel honored to be here, especially when I have Dr. Kevin with me. So I really feel good about it. So let us go ahead, and I'll be presenting the newer device, which is the Advanced Vision Analyzer. It's a virtual reality automated perimeter. It's a US FDA approved device. So I'm going to give a brief overview of what this new innovation is all about. And we have this peer review paper coming up very soon in one of the flagship journals of the American Academy. The Advanced Vision Analyzer, this is the device. This is how it looks like. It has four major parts. That's the head-mounted device. It has a patient response button, the test control device, and it has a backend server, which serves as a cloud. So this is the video which just shows how this device actually is. This is the head-mounted device. This is what the patient actually wears. It's a headband, and it has an adjustable knob on it so that it can fix up. It is attached to the patient response button, wherein the patient clicks the button when the patient sees the stimulus. And then this is the test control device, wherein all the data of the patient and the test strategy and the algorithm, everything is fed into it. And it also has an eye tracking system, that helps to track the movement of the eye. You can adjust the interpupillary distance also on this device, and you can also correct the refractive error and then perform the visual field test in this patient. So basically, this device, it has the programs and strategies that have been fed are the 30-2, the 24-2, and the 10-2 program. And the algorithms are these algorithms are specifically designed for this device. They are the FAST algorithm, which is a screening method, which I think we all are used to using the Humphrey. So ELISA FAST corresponds to the CETA FAST program, which is there on a Humphrey. The ELISA standard, this corresponds to the CETA standard, and then there's also a full threshold program. So it actually offers all the details and all the threshold programs, which all the ophthalmologists are actually used to using it. The important key features of this device is that, it offers the white-on-white perimetry. And as I said before, there is a lens holder, there's an eye tracking subsystem, there is the stimuli are presented at the Goldman size 3 as in other devices. There are cache trials which are fed into this device, and it keeps on checking for false negative and positives and fixation losses. There is the cloud-based storage system. That's one of the major advantage of this device. You can back up all the test reports, etc., all the information, and you can retrieve it as and when needed. And this device, actually, it has its own normative database, and the device, it has been checked before performing the visual field test and coming into the market. We decided on doing the assessment of the blind spot location. These are the basics that a device should go through before it gets validated. And the retest variability of the device is also perfect. It is bang on. It has been checked. This is how the visual field reports. I'm just giving a brief overview. This is how the visual field report it actually looks like on an AVA. And on the right, you see what you see in the Humphrey. So this is basically we are quite acquainted to interpreting these kind of visual field reports. The point-wise sensitivity that we have done a basic basic analysis of patients, of normal patients and glaucoma patients also, and we have compared the point-wise sensitivity values also in all the age group of the patients, and that was a major study that we did on these cases. And there's an excellent correlation between both the devices, and because actually we were just trying to see that how good we stand when we compare it with the Humphrey, because that's the device which is commonly used by almost all the ophthalmologists globally. So I think AVA stands a very good chance because the point-wise sensitivity values, they quite correlate very well. This is the correlation coefficient for both the devices when it was compared. This is actually a 24-2 test which was done, and 54 threshold points on the visual field were analyzed. So this is how the bland element plot and the regression analysis, what you see on the right side, it shows the correlation for the mean sensitivity values for both the devices. This is the mean deviation and the pattern standard deviation, excellent correlation again, which is seen. The only thing that we are coming up now is, which I think every device needs to undergo, and through the development which happens gradually, and that is what we are trying to do, is to get into the progression analysis and the EMR integration for this device. The advantages that I would say with this device are that it's portable. So now that's the major advantage. You can do the test of patient in any position that is comfortable to the patient. There is no learning curve. It's absolutely simple to use. You do not need a designated field, a designated place to sit and do this. Wherever, you can even do the test at patient's home. If the patient cannot come to the clinic, it can be done, and the reports can be easily shared with the ophthalmologist, and treatment can be initiated for the patient. It is cost effective. Almost it is 1/4 the cost of what a normal bowl perimeter costs. It's very helpful in rural areas because you can, especially in the developing countries, and even the developed countries, it would work very well because it gives a lot of freedom. People might not be able to come from rural areas, so you can do that, and you can offer high-end treatment to your patients. As I said before, it allows postural freedom. Patients with spinal deformities and other postural deformities who are not in a position to sit for quite some long time, they can perform the test even in the supine position. And especially the another most important advantage that we have in the post-COVID situation is that the patient can wear the face mask, and then the patient can do the perimetric test, which is actually not possible to do on a bowl perimeter. And you can even make the patient sit in another room. You can keep quite a bit of physical distance from the patient, and you can do these tests. So that's one of the major advantages that come up with this device. So this is a brief overview of what we actually have with this device. And yeah, so that's the information that I actually wanted to pass on to everybody. Thank you so much for this.
Thank you, Priya. That was brilliant and very, very concisely put forward in terms of all the advantages and all the points that are doing the rounds in terms of all portable devices that are coming into the future, especially the post-COVID era. I think this is an exceptional product in it.